I'm Dr. Sri, I'm a board certified family medicine and sports medicine doctor. In this video, I'm going to discuss how to prevent low blood sugar during exercise for individuals with type 1 diabetes, as well as individuals with type 2 diabetes who are currently managing their condition with insulin injections. In type 2 diabetes, some patients manage their condition only with long-acting insulin injections like the Insulin Glargine or the Insulin Detemir. Some type 2 diabetes patients will take a combination of both short-acting and long-acting. So basically the short-acting, again, the Lispro, Aspart, and sometimes they might be even taking regular insulin. And the long-acting could be the Insulin Glargine and the Insulin Detemir. So in this video, we're going to discuss how to prevent low blood sugar during exercise if you're taking only the long-acting insulin in addition to your other medications for type 2 diabetes. I provide a detailed explanation of how these insulin injections work in a separate video, and I'm going to include all the links in the description box below. Now let's understand why there is a risk for low blood sugar during exercise if you're currently on insulin injections. So assume I don't have diabetes. So when I exercise, my body's insulin levels drop, while the level of hormone glucagon and the stress hormone cortisol, they increase. This signals the liver to release sugar into the bloodstream, and thereby they provide energy for the exercising muscles. There are three main types of exercise. So we have a continuous moderate to vigorous intensity activity like jogging or running, or one can do interval training where one might exert maximum effort for a period of 30 seconds to 1 minute, followed by a recovery jog or walk, and they continue to repeat this cycle multiple times. Or one can do strength training, which include activities like lifting weights, doing push-ups or pull-ups. So imagine I'm running at a moderate intensity in the treadmill. My insulin levels would naturally decrease, thereby letting the liver to release glucose into my bloodstream for the exercising muscles. So basically the liver releases glucose into the bloodstream, the muscles absorb the glucose, and when the blood glucose drops, the liver releases more glucose, and thereby our blood sugar remains steady during exercise. Now let us consider high intensity exercise where I'm alternating between running and jogging in the treadmill. In this scenario, there is a lot of stress that is going on. The hormones glucagon and cortisol, they increase the blood glucose levels. So ordinarily, even when there is a decrease in insulin during exercise, there is still some amount of circulating insulin in the bloodstream, thereby preventing the excessive rise in blood sugar that is happening due to the stress hormones of glucagon and cortisol. But since there is a lot of stress going on, the body wants to make sure that the blood sugar does not drop too significantly. So this is why the body creates a state of insulin resistance where the insulin activity is a little bit suppressed. So even for those people who do not have diabetes, their blood sugars can raise up to 160 mg per deciliter during high intensity exercise. Now let us assume that the individual has diabetes and they're currently on insulin injections. Now what happens? Some patients with type 2 diabetes, they may be currently only taking the long-acting insulin, also called as the basal insulin injections. So the examples are the Glargine and the Levemir. So the good thing about these injections is that they don't have a peak. They're pretty much like completely, they're peakless insulin, and there is always some amount of circulating insulin in the bloodstream. But let us say, if you've been taking basal insulin and you've been exercising and your blood sugar remains pretty stable, then you don't have to worry about it. But let us say you decide to start increasing the exercise volume. So let us say I'm exercising almost like 90 minutes per week, and now suddenly I want to do 150 or maybe 200 minutes per week. At that time, the risk for low blood sugar is still high because the basal insulin that you were taking before, and assuming that your blood sugars remain stable, that's more when you are exercising for 90 minutes per week. Now that you're exercising more, your insulin sensitivity improves, and thereby one has to cut back down on their basal insulin, thereby you can decrease the risk for low blood sugar. Usually I'll tell my patients to cut back almost like 10 to 20% or so, and just continue to monitor the blood sugar and make adjustments as necessary. So now that we have understood why low blood sugar occurs during exercise, let's discuss how to prevent it. So to properly manage our blood sugar levels during exercise, we want to make sure that the insulin levels remain low. It doesn't have to be too low. And again, how much low it needs to be depends on patient to patient. But you want to make sure that the insulin levels are slightly low, so this way the liver can keep pouring glucose in the bloodstream, and thereby we can keep the blood sugar stable. Now let us focus first on the type 2 diabetes patients who are currently using only the long-acting insulin. As we discussed before, if you have been exercising pretty consistently with normal blood sugar, you don't have to worry. If you're going to increase exercise volume, then depending on how much exercise volume you're going to increase per week or increase per day, you might have to cut back on your basal insulin, and sometimes it can be a 10 to 20% decrease. And sometimes this varies from patient to patient, which is why I would recommend discussing with a doctor But still, even after you discuss with the doctor, there might be some sort of a trial and error approach in order to figure out the right amount of basal insulin that you would need. Let us assume that you did everything correctly, and now after 20 minutes of exercise, you start to experience symptoms of shakiness, tremors, irritability, sweating. Then you're likely experiencing symptoms of hypoglycemia. I recommend pausing the video here to check for common symptoms of low blood sugar. So what should you do if you experience hypoglycemia? So I cannot emphasize this enough. Make sure, whenever you exercise, make sure that you carry a glucose tablet or a dextrose gel. So this way, if you have symptoms of hypoglycemia, you know how to act right away. I usually tell my patients to carry a glucose tablet or a glucose gel or a dextrose gel because one, you exactly know how much carbohydrates that you're going to get from this glucose tablet and the glucose gel. So this way you can be reassured, even though the symptoms can be frightening. For example, let us assume that I get hypoglycemia and I consume a 15 gram of dextrose gel. I'm pretty reassured that this is going to raise my blood sugar, and then I would check my blood sugar after like 5 to 10 minutes or so, and if my blood sugar is still low at that time, then I can take another 15 gram of dextrose gel to make sure that my blood sugar rises. Most of the time what happens when people take candy or some other form of food to correct the low blood sugar is that they usually take in more and thereby having a hyperglycemia. Basically the blood sugar rises too much, and then they have to correct the high blood sugar rise again, and thereby increasing the risk for hypoglycemia. However, if you don't have any glucose tablets handy to treat your hypoglycemia, then you can use other foods and drinks such as 1 to 2 pieces of hard or sugary candy, or 4 ounces of regular soda, or 4 ounces of juice, or 8 ounces of sports drink that contains like 10 to 15 grams of carbohydrates, or you can consume 2 to 3 crackers. It's always important to have a diabetic bracelet so that other people know how to assist you in case of emergencies. I hope this video was helpful. If you have any questions or comments, please post in the comment box below. If you want to know more about how insulin injections work, so basically the 70-30 insulin injections, the combination of short-acting and long-acting insulin, or just long-acting insulin injections alone, you can find all the links in the description box below. And I'll see you in the next video. Until then, goodbye.